COVID has had a huge impact on families across the country, not to mention the world. But in report after report, we have seen that African American families especially continue to bear a disproportionate share of the brunt. One new study has found that programs like the child tax credit or guaranteed income could play an important part in helping families in need. According to the results, giving extra cash to low-income families for 1 year changed their baby's brain development for the better. One set of mothers received only $20 a month, while a second set of new moms received $333 a month. After 1 year, faster brain activity was measured in the infants whose low-income mothers had received the larger amount. The researchers are now studying whether better nutrition, less stress, or other benefits attributed to the difference. The New York Times noted evidence that a single year of subsidies could alter something as profound as brain functioning, highlights the role that money may play in child development, and comes as President Biden is pushing for a much larger program of subsidies for families with children. The temporary expansion of child tax credits ended last month, and it's not clear if it will end up in the president's final Build Back Better bill. But while this new study may be promising news, it also comes on the same day that a new report revealed how COVID has negatively impacted black children who may be getting lost in the pandemic. According to a new report by the Department of Health and Human Services, child deaths due to abuse and neglect fell last year. But when you examine the figures specifically for black children, that headline is false. 504 black children died from suspected neglect or abuse in 2020, 73 more than the previous year. It was a 17% jump. And black children are now considered 3.1 times more likely to die of abuse or neglect than white children. Joining me now to discuss all of this is clinical psychologist Dr. Jeff Gardere. Dr. Jeff Gardere, I just want to first, this study around brain development is just fascinating to me because, you know, this only happens at one period. You can't go back and redevelop the brain later by making more money later. You have to catch it, make it optimal when it's happening, and that's when the child is first born, when they're young. This small amount of money seems to have real impacts on this brain development of these children. What do you make of that study?
It's absolutely a great study because it talks about the investment in our children. We do know as scientists for a very long time that the more information, the more nourishment that the brain gets when a child is very young, the greater the potential, the higher the IQ, the better the social development, intellectual development when they get older. So when we don't invest, when we look at these programs and think, well, this is about just giving handouts, we are certainly wrong in doing that. This is about investing not just in our black children, not just in our children, but investing in the brain power of our country, because these will become our future leaders. And these are the kids who will not have to depend on subsidies later on. So as I like to say, you can pay now or you can pay later.
So speaking of that, paying, the child tax credit has expired. Biden has said he's not sure if the enhanced child tax credit will remain in the Build Back Better bill and be voted into law. We have now evidence that providing this relatively small amount of money is going to be hugely beneficial, and yet on the political side, it is not going anywhere, and it doesn't look like they're even sure that they want to return to it. What do you make about that split screen?
Well, this is, of course, everything has been politicized that is affecting human lives. And, of course, we'll talk about what COVID has done to certain populations. But the bottom line here is when you take something so important, such as an investment in children and in their development, in their brain development, in their physical and intellectual development, and then we see that later on it becomes a much bigger issue. Well, the shame on the politicians for doing this. And by the way, this isn't just affecting black children. I know that these politics are about divisiveness, about black versus white, the way the politicians try to set it up. We talked about critical race theory in your previous segment, how that's become a bad word where it's only about the accuracy of history. So the politics as we see it today is very poisonous. It's hurting us as a country, but again, the collateral damage, as always, will be the children.
So we have this other report about children dying of neglect and abuse. Overall, seem to be dropping. But when you looked at just black kids, it was up 17% during this pandemic from 2019 to 2020. What do you make of that trajectory for black children in particular?
Well, as we know, COVID has disproportionately affected people of color because of where they live, because earlier on, lack of access to the vaccine, higher COVID rates, and so on. So what we saw was with the interruption in the schools, with social distancing, children staying at home, even the reported cases went down. We know that, or we surmise that, of course, that the deaths of children, being exposed to domestic violence, either watching their parents engage in it or being direct victims of it, those rates went up, but those were invisible cases because we didn't have the schools being able to call out these cases. We didn't have people reporting the cases, and we had so many people sick that there weren't the caseworkers who are out there who should have been investigating these particular things. So, Charles, as we see over and over again, the iterations of COVID-19 and how it has affected our society and especially affected those who are much more vulnerable, the underrepresented minorities, black and brown people, well, that situation just continues to develop in a very negative way.
Let's follow up on the caseworkers you just mentioned. Child services are now doing something like 10% less case reviews than pre-pandemic. And when there were already disparities and gaps in how many black kids were investigated and other people, you know, these kids can't seem to win for losing. You know, there are parents who are considered to be indispensable and have to go to work. They are stuck at home and not having the appropriate kind of school setups as some wealthier families might have. This kid might have 4 people in the room with him at the time that he's doing his studies, while some other kid may be able to go into a room that is only theirs and do something in quiet. And then on top of that, you have the stresses around the pandemic, and there are not enough caseworkers, and they're not doing enough case reviews. Just give us like a grand picture of what, where do our black children stand right now, and what can we do in the pandemic, because we're just not out of it, but they need help now.
They really do. As we know, they didn't have the internet capabilities when they had to stay home. They didn't have the devices. They couldn't get out for their medical visits. A lot of the services for children who had special needs, those things went into online. And as we know, that really didn't work because we needed those folks who give those services to be there in the school with the kids or come to their homes, and they couldn't do that. We have also seen that our children, especially black children, have lost an average of 5 months with regard to achievement in mathematics, 4 months with regard to reading, and of course have lost all sorts of social skills. So, of course, as always, those who are much more vulnerable, those who are part of a society or a system that are treated as second-class citizens, are still going to get less services and still going to be impacted in a greater way, in a much more negative way. And until it's almost like what we're looking at with the vaccine, right? Until we're able to vaccinate the whole globe, we're going to be living with COVID in one way or another. So that's the same situation here in the United States. Until we take care of all of our children, black, brown children, poor white children, and so on, then we're still going to have these inequities and health disparities in the system. You can't look at yourself as saying, well, I'm doing well, my kids are doing well, everything is okay, because as we know, if we don't take care of everyone else, it is a drag on the system, and therefore everyone suffers at some point or another. We've got to take care of everyone.